recently been working with a number of vendors who are involved in the storage and the management and the integration of healthcare information. Folks like Socrates Analytics here in Cleveland and Box.com. I'm very concerned that the consumer does not have an adequate voice, even with HIPAA, for the management of the security of healthcare information. Do you see HIMSS stepping up to be a voice for the consumer in the security of the information?
I see HIMSS having currently a role as well as a future role. Currently, we're very engaged in the conversation around data security. It is a subject that many are very concerned about because that's what we read about in other business sectors, the hacking into databases and the identity theft and issues like that. So we're all very sensitive to the issue of data security. So currently, we work a great deal with companies and providers to make sure there is very strong education, case studies, best practices understanding about what's needed in data security. So right now, I'd say we are right there working on that issue with the industry and the provider sector. Going forward in terms of the consumer's voice, the problem that we have with consumers right now is, for the most part, unless you've got a chronic disease, I would say that most everybody in this room really is not an engaged consumer in their health care. It's just one of those things that we don't pay much attention to. Now, as I say, if you have a chronic condition that is ongoing in such a way that it is in your face all the time, of course you're a very engaged consumer. But that's really not the majority of the population. So we've got to get to that point where we take responsibility for our health care. We take responsibility for understanding what it means for my data to be available electronically. And recognize the balance we have to achieve between that electronic access and privacy and security. And as I say, I would agree with you that at this point, no, the consumers aren't deeply engaged yet, but we've got to get the consumer engaged on a lot of healthcare subjects, security only being one of them. We're starting to develop some thinking inside our organization about how to reach you as a consumer. And we haven't got the strategy figured out yet because we're not a consumer organization. We don't have millions of people that we automatically can reach. We've got the information that consumers ought to have and understand. We've got to figure out how to connect with them. So I'm with you there in terms of trying to find out.